That's the bad spot, sorry.
Yeah.
Got it.
Yeah.
There we go. There's the shake. Good shake.
The shake is happy too.
Hey,
Hi, Dr.
I heard you wanted to bring your dogs in.
Yes, so one of my Pomeranians, Lola, she did something to her back leg. So we actually had to get a stroller for her. We've gotten x-rays and we really don't know what the problem is. And of course, I was searching the internet for the best dog chiropractor, best animal chiropractor, and I stumbled upon you and I was like, Lola has to see him. He is a master healer. So I would love to bring her in. We also have another little guy, Meeko. He's not currently injured, but he was a couple years ago and he had a similar problem. So I don't know if it's just like a small dog doing things they shouldn't be doing problem.
Are they both Pomeranians?
They're both Pomeranians, yeah.
And what are the age differences?
So Meeko is younger. He's 7, but Lola's 10 years old.
Okay, Lola. And Lola's the one you're most concerned with because of her inability to move the same way. When did that all start?
It started initially like 2 years ago. She kind of healed herself. We don't really know what happened. One day she just started walking again. And so we just were very, very careful with her jumping and doing things like that. And then about a month ago, she started kind of sitting on her hind leg and like scooping it. And you could just tell from her expression, like she's in pain.
Could you tell if one leg is worse than the other visually? Like you could say it's definitely the left, it's definitely the right.
You'll see when she's walking that it's on the back right side and she kind of will like sit. She'll kind of like fall on that side. I don't know if it's like a pinched nerve or something that's not activating that muscle and just making her have a lot of pain.
Is she the type to bite the veterinarian when she's at the vet? Like, should I get a muzzle ready?
Yeah, probably.
People ask me, do I ever get bitten? And I have, and it's usually like the Chihuahuas that bite me.
Yeah.
We have an opening like right now. Do you think they can come right now?
Oh my God, yes. So I'm actually in Los Angeles, but my parents have her in New York, and I know you're located in New York, so I could call them right now and have her come.
When they get here, we'll be ready, but let's do it right away, you know?
Okay, that'd be amazing. Oh my God, thank you, Dr. Dash.
All right, so we'll see what happens. She's calling her parents right now, and we'll see if we can get them in. I don't know. We'll do what we can do. All right, can you see me, Veronica?
Excellent.
Look who I have here. I have your babies are here. So this is Lola, of course. I'm telling not just you, but people watching this on video. This is Lola. She's about 10 years old. This is Ella and Victor, Veronica's mom and dad. And then the other dog's name is?
Meeko.
Oh, Meeko.
Like
I can
the
say
little
that.
raccoon.
You hurt yourself recently. I'm sorry. Back right leg. I always like to ask permission, so I always ask if I could work with Lola. Could I work with you today? Would it be okay if we work? You gonna bite me? Maybe. I already see the lip. The lip is going like
Quivering.
Yeah, like I'm gonna bite you. I swear I'm gonna bite you. Before we start, let's get her on the ground really quick.
Come to me. Come here. Come here.
Yeah, and then she sits right away. Notice she falls to her left hip. There's a term in medicine called antalgia, which means away from pain. Ant means opposite or contrary to, and algia means pain. And so she chooses the left hip to land on because the right hip is more sensitive. Okay? So we stay away from pain. That's why when someone has really bad sciatica, you'll see them lean to one side. They're leaning away from the most pain. Typically what we'd see if the right hip is worse, why would you want to land on your right side? That would only exacerbate or flare up what already hurts. So she went boom on her left. Here, let me do it. Boom on the left. How was that?
Yeah, that was great.
All right, so let's get started. So I was back up at the right, or the neck, and what I found already was the right cervical of the first bone in the neck, C1, is a little tight. So I'm gonna reach under and just flick it down. And I'm at the right transverse process, or the right wing of the atlas. There we go.
Ooh.
Just give her a second. And I flicked it down. So I grabbed the arch of atlas. Here's one for a horse. So this is plastic, it's not really, but this would be the top bone in the neck, right here. and I grabbed the edge here and I pulled it down. Boom. So similar, except hers is like this big.
Yeah, tiny.
Dogs have 7 bones in their neck. They have 13 in their mid-back. All mammals have 7 bones in their neck except the manatee and the sloth. Giraffes have 7 bones in their neck. Lola has 7 bones in her neck. Veronika has 7 bones in their neck. But we differ in the mid-back. So from here to here, the thoracic area, we have 12, they have 13. Dogs have 13. Horses have 18. Dogs have 7 bones in their lower back, which I'm going to really need to look at for her. Humans have 5, horses have 6, so it's different depending on the species, but we all seem to have the same neck bones, pretty much except the manatee or the sloth. So I'm going to check the rest of the neck bones first. So I did C1 already, and I'm coming down, and there's a bad spot at C5 on the right, which is right about here, and I'm going to adjust that one too. So I'm going to reach under. There we go. And that just made a click.
Oh!
That just made a little
I
click.
heard that.
So now we're coming.
Did you hear that?
Now I'm in the upper thoracic area between the shoulder blades. And we all get tight there from too much texting, right? But I don't know how much texting Lola's been doing lately. But if she was, she would get tight there as well. So she actually has something here at T7. So this is really at the very bottom part of the scapula area. The withers on a horse dog area is pretty much the 3rd through the 8th bone of the upper back, and we're at number 7, so we're almost out of that zone. But there's a really tough spot here, and this would not affect our hips, but I'm just checking everything. And okay, she's letting me work.
Good.
So now I'm coming down the back. Now we're getting into the area that could affect her, which is called the thoracolumbar junction. T13 and then L1 is a high incidence of degenerative joint disease, degenerative disc disease, arthritis, bad cartilage, inflammation on, especially, humans get it too, but especially on the quadrupeds, because they're dealing with gravity. So they have 4 legs on the ground and their belly hanging in the middle. And that's why we also even see a higher prevalence of that in dachshunds and basset hounds with the longer torsos. She's definitely tight in here. So
she's feeling
and she's feeling it. She's like blinching and wincing a little bit. So I'm sorry, babe. But now I'm going to get a little set in here. She's in a perfect position because she's flattened out. There we go.
That's
here's
it.
another
That's
one.
it. You're a good girl.
That actually popped.
That's it.
So this is a percussive instrument. It taps the bone. Feel this, Ella, so you can feel it against your hand.
Oh, cool. That's like you bought for me for my back.
Yeah, it would be good for you. And I'm just coming up that area. Now I'm into the lumbars. So dogs can get sciatica, believe it or not.
No.
And so can horses. And sciatica is just the name of a nerve, right? So we have the sciatic nerve. There's one on the right, one on the left. Those lower nerve roots braid together and come down the back of the leg through the hamstring, through the calf, and can make you really have a bad limp. But I don't think that's her case. I think there's a couple of things I'm interested in. I do want to check the kneecap because smaller dogs do get subluxating patella. But right now, as long as she's letting me, I'm adjusting her lower back and sacrum. Now I'm switching back to fingertips. There we go. I cannot believe she's giving me all this.
Good girl, Lola.
And there we go. I just adjusted L7. Now I'm going to take the tail and just like mobilize it. It's not a yank because we wouldn't do that, but sometimes you can get the sacrum to relax a little bit. And the tail feels good. So I'm at the first coccygeal segment, which is the first tailbone segment because there's segments in the tail. And that feels good. Now I'm going to do a doggy arabesque. Did you ever take dance, Veronika?
Yes.
Okay, do you remember like this is the arabesque where you lift your leg up and then you do this with your arm? Like, so
that's called lastechka.
Lastechka, da.
Yes, da.
Da.
So I'm getting good range of motion on this hip. Let's try to set it down. There we go. Good.
Good, Lola.
Her hips actually feel pretty good. So now I'm going to keep working. How you doing so far? Are you listening to all this? Now I'm massaging into the lower lumbars, the QL area, quadratus lumborum. On the either side of the lower lumbars, there's a big old muscle knot on the right. So I'm thinking, from what I felt so far, she's got much more of a lower disc that's hitting her hip a little bit. And she's letting me work hard. I'm massaging deep. I'm going in with my thumbs and in with my thumbs and in with my thumbs. Now I'm going to check the hamstring, semimembranosus, semitendinosus. The membranosus is more medial or towards her midline. Tendinosus is the outside. These are different branches of the hamstring, and they're feeling good there. I do feel iliopsoas is locked up. That's the muscle in here that helps us flex the leg up. And you need that to jump, you need that to walk, you need that to excel out of a standing into accelerating forward for forward momentum. And that one feels really locked up, so I'm going to massage that for a little bit. That's a tender area on anybody. If I went in to you and I grabbed this area and started rubbing, it would be very sensitive on everybody. This is the area we protect the most, right? It's our most vulnerable area for animals. We don't want to be attacked, or so that's our vital organs are on the anterior side of our body. And so now I'm working my fingertip into the iliopsoas muscle on the right side. I find it extremely tight, taut, and in spasm. But she's actually giving into this, right?
She's very smart.
Yeah.
She's feeling everything.
She's like, okay, he's not that bad. He talks too much. But
She's like, it feels
but I have good hands. I have good hands.
In a massage.
She understands.
I mean,
You helping to
Yeah.
her. She
Yeah.
knows that. You know?
Yeah, your dad's saying she understands I'm helping her, and there's a part of her that knows that. Let's bring the dog back into a extension or arabesque. Now we're going to bring your leg forward, and then into abduction. Ooh, it just clicked. So I just put my finger on the patella. I got the patella to pop back in. So the patella was out on that side. That's the kneecap. I might be done at this point. Let me just do a little bit more. So I'm going to change the instrument. So someone like Lola might need a couple of treatments because she's older now. She's a senior dog. Okay. Hey, listen. Okay, I'm not as young as I used to be either.
She's great.
She's gorgeous. So I'm just doing a little bit more in the L6, L7 lumbar. Now I'm going around the hip a little bit, and now I'm going to go up under into the iliopsoas with this percussive instrument.
Oh,
And that's a bad spot. Okay, let me just check if the ilium is anterior and superior. This could make the dog yelp, so I'm going to pull straight up. It's called an AS ilium correction, and usually it makes the dog go. So I'm just warning you, okay? I got it, and she didn't yeep.
Good.
So now we're going to put her on the ground. We're going to want to see two things when we put her down. We'll see if she wants to shake out. That's when they go like. I don't know if I did a good job. Was that okay, the way I did that? No.
Can I take
Yeah. We're going to take the muzzle off, and we're going to put her on the ground and see her walk around a little bit. Can you take her and put her down on this side, Ella? Here's the shake.
Good girl, Lola. Good girl. Wow. Wow.
She's great now.
Yeah. She's happy. Look
My
at this.
baby.
Oh my god, she's so
My
happy.
baby.
You see, she didn't collapse.
Kitty. Oh, you're so tired.
Ella, did you see she walked further without?
Absolutely, absolutely. Look at that.
Happy.
Look at. Oh my God.
She looks good, right?
Yeah.
Here, talk to her for a second.
Johnny. Johnny, did you have a good time?
Dear Veronika. Dear.
Wait, she's so happy. Look at her face.
Oh, look at that. She didn't do that for a long time. She can't scratch her ears. That's
All right. So not bad, right?
Great
Now
job.
she might need another treatment because she's a little older. And I didn't say that, but she's a little older. And but we did a good job. I worked on the muscles. I adjusted a few segments for sure, and I did some painful stuff too. She let me get in there. For some reason, she let me. Your dad said because she kind of felt like she's okay with me. She's safe with me. All right, let's do something with your other dog. So Meeko again is
7.
7. Okay. Hey Meeko, can I do a little checkup on you today? Meeko?
Sure.
What do you
Yes,
think?
doctor.
All right, good. It's always good to ask. One of the things I like to check is range of motion with the neck. So the neck, the nose should come all the way to the ceiling. So I don't know if you guys could see this from the side, but a little stiff. So let's do something to fix that right now, okay? Because we want the head to come all the way up, all the way up. So I'm gonna grab both wings of the atlas and flip them back. Got it. All right.
Good, you have.
But now watch the difference.
Yeah, it is different now. Wow.
This feels good. A little bit here at sacral base. That's the bad spot, sorry.
Yeah.
Got it.
Yeah, that's good.
Hey, baby. Oh, hey, baby.
Good baby, man. My good
Such
baby.
a drama king.
And let me just check the front leg.
Look at Lola.
And the front leg is good. Good, let's check the back legs. First I'm gonna bring them up,
So. Stay.
and then extension,
Hey,
forward, checking each
Lola,
joint.
you happy baby?
Okay, good. Ooh, that one just clicked. Did you hear it click? All right, so the back left hip just adjusted, which is really nice.
oh, good.
Let's put him down. Let's see if he shakes.
Иди к маме.
Mika, бегом.
There's the shake. Good shake.
This thing's happy too.
Mika.
So she's walking a lot better. She still needs some healing time, and I would be very careful not to have her off leash for a couple of days. So don't let her out in the doggy park running around like crazy because she'll overdo it. So when you're outside, please be on a leash.
Yes.
Give her a little time. Also, don't do too much too soon. So like, let's say you have her walking, then pick her up.
Yes.
Because she's still going to be inflamed.
Right.
Just like if you sprained your ankle, and let's say I set it, you go, now it's working better, but it's still inflamed. And it needs a couple of days for it just to relax and so don't have her do too much. Don't let her jump if she doesn't have to. All right, so are you happy with this? Was this okay?
I'm happy. You're the best.
All right, thank you. You guys are the best.
We are so happy. Thank you,
All right.
doctor.
Thank you.
You are the best.
Number one.
Number one in New York and all
you.
United States.
Thank you, guys.
Thank you so much. I don't know who's more happy now. Dogs, you, or
Pomeranians.
me. Thank you.